The next speaker is Fatma Aykul Hanım. Hajj is also related to the nutrition, so Fatma Aykul is going to talk to us as Hajj as an example of collective nutrition. Fatma Aykul is a dietitian working for the Ministry of Health. Hello, I am from the Public Health Directorate. My name is Fatma Aykul. I am a dietitian by profession. I'm going to talk to you about Hajj as an example of collective nutrition. You have 15 minutes, Mrs. Aykul. Yes, I know it. Yes, I'm going to try to keep it short and concise. When we have a look at the collective nutrition, we see that it is a type of nutrition where people consume food outside their houses, and most of the time the food is served by professional organizations in collective nutrition. It is actually for at least one meal, the nutrition needs of the consumers are met psychologically, physiologically, and socially by a professional organization, and the profile and characteristics of the consumers is actually getting higher and higher over time. So that's why the collective nutrition is very important. According to the Turkish nutrition guideline, nutrition is defined as the consuming the bioactive components and the nutritional elements which are necessary to improve the life quality, to protect the health, to improve the health, and to promote the health. In this respect, healthy nutrition is actually based on the variety of the food that you consume, and you have to make sure that the energy and the nutritional elements that you need on a daily basis is taken into your body through the food that you consume. Actually, we can have 5 groups of nutritional elements: dairy products, protein group products like meat and eggs, bread, vegetables, and fruits. So you can see a healthy dish example in this visual. In this healthy dish, you see that there are food items from every 5 groups of food. So we have to make sure that there is one item from every 5 of the group is put on our dish. And for instance, Mediterranean type diet is an example for this, because they consume high amount of olive oil as well. What are the quality objectives in collective nutrition? First of all, sufficiency in the menu. The age, gender, body weight, physical activity, and characteristics of the target audience, the group that you are serving, should get enough food to meet their energy needs. And when it comes to the variety in the menu, there should be enough variety of food in the menu to be able to meet of every food group. And we have to have strike a balance between the number of meals that we consume and their distribution. So in line with the variety principle, the number of meals and their timing is very important. And we need subjective quality. Subjective quality is actually related to the color, odor, or the taste of a plant, and it may be when you are buying the raw food for the meals or for the presentation of the menus, there are the high quality subjective quality objectives which may vary from one society to another. High nutritional value, we have to protect the nutritional value, and when we are buying food, processing it, producing it, and serving it, we need to pay attention to appropriate storage, preparation, and cooking techniques, and we have to use those techniques to keep the nutritional value. And high hygienic quality. We talked about infections quite a lot, and unfortunately hygiene and food related hygiene problems are very common. So in order to protect the health of the consumers and prevent food poisoning during the collective nutritional service procedures, food hygiene, personnel hygiene, vehicle hygiene, and tools hygiene must be all abided by. Economy in all collective nutrition system, of course, economy and cost effectiveness are significant. We have to, of course, pay attention to the variety of the food, high quality food, or the subjective quality, but we have to produce and serve this food in the most economic manner possible, because this is enabling a lot of gain for the service providers. This is actually a process map of the collective nutrition, which is a summary of all the steps that I talked to you about. We have to start with planning. Planning is the first step before we reach quality. Procurement, delivery, storage, preparation, preliminary preparation, cooking, cooling, warming, portions, or service. So in all of those phases, food safety management systems should be there, and management and organizations should be planned accordingly. When it comes to the planning, what are the factors that we should pay attention to? If we have a very good menu planned, then the first step of our objective is already achieved. Food variety should be ensured so that people don't get bored eating the same thing over and over again, and this is also very important for healthy nutrition. Ingredients should not be the same when you are selecting the food. For instance, rice stuffed aubergine and rice should not be served at the same time, and energy is an important factor. For instance, rice and pasta should not be served at the same time. Organoleptic characteristics of the food should be compatible, like soup and compost should not be served at the same time. Because of the legislation, there are actually some minimum requirements regarding the amount of food that should be provided. This is very much related to the first group meals, which is like meat meals. In this respect, we should pay attention to the weekly cost balance. There are, of course, technical specifications in the collective nutrition, and in those technical specifications talk about the grams of the food to be served. We should abide by them in the strictest manner possible. Of course, there are institutional characteristics that we may need to take into account, like the institution may spare a budget for food services, physical conditions of the kitchen and the dining rooms or lunch rooms, qualifications and amounts of the kitchen tools, or qualifications and the number of personnel, etc. So during the Hajj, we see that collective nutrition services may sometimes have to be provided under very challenging conditions, because among the pilgrims there are very young people, there are children, there are the elderly people, there are people who need a lot of energy, there are people who are a bit inactive. So when you are planning this Hajj nutrition, it could be really challenging. When it comes to the characteristics of the consumers, we should take into account their energy and nutritional requirements, their dietary habits, biological, physiological factors, geographical factors, sociocultural, demographical, and religious factors related to such people. So you have to take into account their biological characteristics. In addition, people may have different food or dietary habits because they come from different places, and you have to consider all of them, and you have to provide service to such people in a very different geographical location. In this respect, because of the technological advancements that we have experienced recently, our lives have become a lot more easier. Food which is safe and healthy can be defined as a food which hasn't lost its nutritional element and which hasn't lost its chemical and physical characteristics. So what are the most common reasons for food poisoning? Not cooling the food under appropriate conditions, under proper conditions. During the preparation or service of the food, temperature and time relation may not be maintained, and the food may not be cooked at the necessary temperature, and food that should be served under hot or cold conditions may be kept under improper conditions, which can be a cause for food poisoning. Or sometimes the contaminated raw ingredients are used, or sometimes there are practices which may lead to cross-contamination. If you are slicing meat on a dish and you are using the same dish to slice salad, then this can lead to cross-contamination, or there may be contamination from the poisonous substances, or the food may be supplied from unsafe places, or food may be kept under improper conditions. So these are the reasons for food poisoning. In consequence, I can say that all the steps that I just talked to you about are very important for promoting health, for protecting health as well. So these are the steps of the collective nutrition, which are very important for serving the healthcare needs of the people. I didn't talk to you about COVID-19 because, scientifically speaking, there is no proof saying that COVID can be contaminated through food. But of course, people are removing their masks when they are eating, which is actually increasing the infections. That's why the lunch rooms or the dining rooms should be ventilated accordingly, according to the rules. And of course, when people sit around the table, social distancing rules should be followed. In this respect, according to the Hajj circular of the Presidency of Religious Affairs, the food services team seem to be qualified enough. They have the qualifications to provide the pilgrims with food under healthy conditions. Collective nutrition services, personnel selection, performance evaluation can be managed with a chief dietitian. So a chief dietitian can be assigned for the personnel management and organization issues. Every year we may actually collect data through surveys, and that's how we can provide evaluation and monitoring. In this respect, collective nutritional services provided by the Presidency of the Religious Affairs should be updated according to the Ministry of Health recommendations. So this guideline is a guideline which includes the list of the amounts of the food in grams, and in the annexes there are also some explanations concerning collective nutritional systems. When we were producing that guideline, we collected opinion from the Turkish Presidency of Religious Affairs, and that was the web link of that guideline. Thank you very much for the attention. I hope that I kept my presentation short enough. Thank you very much. Thank you for finishing it in time.
Thank you.